year 2021. The global pandemic spread has been accelerated. The accumulated cases amounted to 97 million, and in both hemispheres. And in many countries, they have registered the sporadic outbreaks. This pandemic has wide-reached circumstances, and also a lot of people in the old age group are most fragile in front of the pandemic. And also the community-based outbreaks are one of the major characteristics of this pandemic. So in our country, General Secretary Xi Jinping has given us important guidelines, and also Premier Li has said that we have to consolidate the primary level of response to COVID-19, give more care to the key groups of people, and strengthen our early warning system and alert system, improve our testing capacities so that we can know the basic statistics about the pandemic, and we have to fight against the cross-contamination and also improve our capacity in the medical treatment. And in the epidemiological tracing of the pandemic, we also have to do a better job. Today's topic is the latest measures on COVID-19 prevention and control and the medical treatment. We have invited the Inspection Commissioner of the Disease Control Administration of NHC, Madam Wang Bing, Inspection Commissioner of the Administration of Medical Policies and Management of NHC, Madam Guo Yanhong, Deputy DG of the CDC, Mr. Feng Zijian, and DG of the Department of Infectious Disease of the PKU #1 Hospital, Mr. Wang Guiqiang. They will take your questions. And now the floor is open for your questions. Please first identify yourself before giving the questions. Thank you. The first question, please.
南方周末记者提问：根据
I'm
河
from
北发布的新冠肺炎
Nanfang
确诊病
Weekend.
例行动轨迹，多个所
According
卫生
to
实
the
惠小诊所接
declaration
种
of
过
the
去诊病例，
trajectories
农村医疗卫生条
of
件和医
the
疗机构
confirmed
能力
cases
是
from
薄弱，
Hebei
但发生疫情蔓延的
province,
风险
a
可能
lot
更
of
大。
them have
请问农
visited
村疫情防
rural
控方面将采取什么措
clinics.
施？
So
如何
what are
发
the
挥基层
measures
乡
to
镇卫生院、村卫
consolidate
生
the
室各级
response
诊所的
against
效力？
COVID-19 at rural level? And how can we bring into full play the roles of the clinics in the countryside? I'd like to give the floor to Madam Wang Bing. Thank you very much for your question. As is mentioned by you, a lot of primary level institutions are very weak, and they are also very fragile in terms of the COVID-19 response. And the Spring Festival is drawing near. Many people would go back into the countryside for the celebration with the families. So this is a big challenge for the primary level and the countryside response to the COVID-19. So in that context, we will work more closely with the local level in order to have a more targeted solution. We have taken the following measures. First of all, we have asked the localities to set up the 3-level responsibility system so that everyone would play their part. The county level and township level, as well as the village level, will have their own responsibilities taken care. And second measure is to strengthen our efforts of promotion and knowledge sharing with the rural residents, and we will continue to encourage and invite those rural citizens to wear the masks and also regularly wash their hands. And during the festival, we ask them to streamline all the activities. For example, the weddings and the funerals, they have to reduce the unnecessary activities and reduce the occasions of excessive gathering of the people. And third, we have to strengthen the screening capacity. More people would go home and travel around the country during the Spring Festival season. So for people coming back from those key areas, and also people working in the high-risk regions would be the key targets. For example, the people working in the coaching area, after going back to their hometown, they will be registered in our system, and we will also keep a close eye on them during the 14 days of quarantine period. We also hope that these people would reduce the visits to other places. And fourth, for the rural clinics and institutions should play a better role in discovering the possible cases. For the people that have respiratory abnormal symptoms, for example, the burning throat and also the fever, we have to keep a close eye on them. And fifth, for the rural levels, we have to set up the epidemiological research teams and also set in advance designated hospitals and also quarantine areas, and at the same time prepare the designated vehicles for the possible transportation. Once there's an outbreak in place, we have to immediately make reactions to that and start the epidemiological research. And we have to set up the area zoning according to science and technology principles, and also set up the quarantine areas. For the people visiting this place, we have to do the disinfection and also registration work. Every item should be carried out according to the rules and regulations. If our work has been carried out according to the rules, then there will be no major risk during this particular moment. Next question, please. I'm from Xinhua News Agency. Until now, we have 1 high-risk area and 73 medium-risk area in the country, and the Spring Festival will bring more people on the road and also in the circulation. Does it mean more risk during the Spring Festival period? I'd like to give the floor to Mr. Feng Zijian. Thank you for your question. Currently, we have some regional outbreak and also sporadic outbreaks. After entering into winter season, globally we have witnessed the rising tendency of the cases, and that is the major cause for the rising tendency of the cases in China. However, during the past year, we have gained a lot more knowledge about the pandemic. So today we have the early discovery and also the early screening mechanism. So there will be no possibility of a major outbreak during the Spring Festival. However, we have to admit that with more people circulating in the country and also with more circulation of the goods and necessities in the delivery system, as well as the increasing importation of the cold chain products, there will be a higher risk of imported cases. So against that context, we have already the measures in place. If we can apply all the measures, then we can avoid the outbreak of a major pandemic risk. Next question, please. I'm from China Daily. Recently, for the key groups of people, we have started the vaccination work. For people traveling from the medium and higher risk regions to the low-risk area, do they have to be quarantined? I'd like to give the floor to Madam Wang Bing. For people already vaccinated, most of them could generate the antibodies, and this will protect them from the contamination. But still, for some people, they cannot generate the antibody, or they will generate a limited level of antibody. This means that still there is a risk for them to get contaminated by the virus. And then we have just started the vaccination for the key groups of people. So they have just received the first round of vaccination. So the protection is not yet in full range. That's why if there is a circulation of the people with the flow of the people, if they come from the high and medium risk regions, they still have to follow and respect the requirements and regulations in the low-risk area, and by doing that, we can ensure that everyone's in safe conditions. Next question, please. Thank you. I'm from CCTV. Recently in Shenyang and Shijiazhuang, there are severe cases among the elderly persons, and you have also sent experts teams to help them. What are the differences in the current treatment compared to the previous treatment plans? I'd like to give the floor to Madam Guo Yanhong. Thank you very much for the question. In Hebei and in Liaoning provinces, there are clusters of contamination, and the whole population in the country has attached great importance to that. And most of the cases, they are suffering from the cardiovascular cases, or they are elderly persons. The average age of the confirmed cases in Hebei, they are more than 50 years old, and 30% of the cases are more than 60 years old. And in Shenyang, confirmed cases above 60 years old represent 37%, and the average age of the confirmed cases are around 50 or more years old. So today we have the four concentration of patients, policies, treatment, and experts, the four concentrations policy. So for Hebei province, immediately they have prepared a designated hospital. So all the confirmed cases are concentrated in that designated hospital. And immediately we have also sent the national level of medical teams to collaborate with the local doctor teams and also the expert teams. Together, they will elaborate a very good solution and treatment plans for our patients. And also for the severe cases in Hebei and Liaoning, we here at national level, we also give the distant remote consultation services. And during the treatment, we would like to take measures in advance. For example, for the light cases, mild cases, we have very reactive policies and also measures. We would count their low oxygen indicators and also the other relevant medical indicators so that the mild cases will not develop into the severe cases. As to the severe cases, we would give them tailored treatment. We have sent the experts to the place, not only for the ICU, but also for the respiratory discipline and also for the cardiovascular discipline. So today we have considered the special characteristics of all those elderly persons with some chronic diseases, because at the same time we have to treat with their basic conditions, the preliminary conditions like the chronic diseases, and at the same time we have to keep up with our efforts to treat the COVID-19. And we are also using the serum from the recovered cases, and we're also combining the Western medicine with the traditional Chinese medicine. We are combining the efforts from multiple disciplines, and at the same time, we come up with the solutions in terms of the psychological consultation and also nutrition balance. For the treatment in Hebei province and Liaoning province, we have dispatched 30,000 milliliters of serums from the recovered cases to treat the hospitalized cases. Currently, the severe cases in both provinces are in a very stable status, so we have a lot of confidence in curing them. Thank you very much. Next question, please. Thank you. I'm from the Phoenix Media. Now, it's less than 1 month before the Spring Festival. However, we have discovered the sporadic outbreaks of cases in many regions and provinces. What are the measures to come up during the Spring Festival season? To Madam Wang Bing, please. Indeed, in several days, we're about to celebrate the Spring Festival. There will be more people coming back from other countries, and in the country, there will be more people traveling around in order to go back to their hometown to celebrate the Spring Festival with the families. And there will be more indoor activities during the festival. At the same time, for the logistics side, more goods will be circulating across the country. Those are the factors of risks during the Spring Festival season. Currently, we are facing a major challenge brought by the approaching Spring Festival. The most important measure is repeated. That is to apply all the measures for the regular response against COVID-19. We have to ask the 4 different parties to shoulder their responsibility. First of all, for all the localities, they have to shoulder their responsibility as the authorities. They have to set up a system of direction, and the officials should be on duty during the festival. The departments and institutions engaged should strengthen their practices and rehearsals just in case of an emergency. And secondly, departments involved in the Spring Festival should reduce unnecessary gathering of the people. They also have to ask every individual to strengthen their personal protection. When we apply those measures, departments should share information one with another. And thirdly, every unit of work should shoulder their responsibility. For the ports, transportation stations, railway stations, airports should apply the 5 principles. They have to elaborate their own guidelines. They have to create their own system of management. They have to select their person in charge. They should also receive the support of the local CDC and medical care system, and also prepare in advance in quarantine area. And fourth is that every individual should shoulder their responsibility. During the Spring Festival, every single person in the country should wash their hands regularly and keep the ventilation at home, and also wear the masks when they are going out. If you have a need to visit another place, then during your trip you have to stay safe and also take every protective measures. I also would like to make a call to all the citizens in the country. If not necessary, please avoid traveling during the Spring Festival. If you do want to travel a little bit during the season, then you have to carry out your trip more in a staggered manner, and also you have to follow the regulations and rules of the destination, city, or region. And you feel uncomfortable, then you have to wear a mask before going to the hospital or to the clinics. Next question, please. Thank you. I'm from Hong Kong Jingyi Journal. We have purchased 1 million doses of inactivated vaccine. We'd like to know more about the details of the safety and efficacy of this vaccine. Today we have invited Mr. Ying Weidong, the chairman of Sinovac Biotech. I'd like to give the question to Chairman Yin. Thank you very much. We have developed our vaccine from Sinovac Biotech. From April 2020, we have already entered stage 1 and stage 2 clinic trials, and it's proved effective and safe. And in Brazil, Indonesia, Chile, and other countries, we have started the stage 3 clinical trials. We have started the first round of stage 3 clinical trials in Brazil, and in multiple countries, we have applied the same series of COVID-19 vaccines, though they have started in according to different timetables. But currently, according to our results and also the statistics, first from Turkey, we have the midterm results. The efficacy ratio reached 91.25%. And in Indonesia, the protection rate reached more than 64%. And the protection rate of this vaccine for the hospitalized case reached 100%. And the protection ratio for the people that have a need to go to the hospital for the treatment reached 78%. And the protection ratio of the medics working in high-risk regions also reached more than 50%. Our inactivated vaccine from the Sinovac biotech has been proved effective and also safe. Those are the progresses that we have achieved. In the production line of Sinovac biotech, we have realized a capacity of 500 million doses per year. And with the approval and examination of the NHC in Singapore, Chile, Turkey, and Brazil, we have also accomplished the examination work. So this means that we can guarantee the first stage of production of 5 million doses, and for the second stage of the production, another 5 million doses. So in total, we already have the capacity of production of 1 billion doses for the first two stages. But that is not all. We have already received new orders, including Indonesia, Malaysia, Singapore, Turkey, and Philippines. They have communicated with our authorities and also signed contracts with the Sinovac biotech. In Indonesia, they have approved this inactivated vaccine in an emergency use. Their president has been officially vaccinated with our vaccine from our company, Sinovac Biotech. At the same time, domestically, we have also offered the doses for emergency use. We have already offered 7 million doses to different provinces and cities, for example, Beijing and Guangdong province. So vaccination is on the way, and we're also keeping a close eye on the application of this work. And we have also handed over the documents related to the vaccine, and with the Special Administration region of Hong Kong, we will offer our products according to the contract and also according to the schedule. Next question, please. Thank you. I'm also from a Hong Kong media. Recently in Shijiazhuang, we have adopted several measures, for example, the close down management measures, and also we have forbidden the inbound and outbound vehicle circulations. So this reminded us of last year's close down measures in some cities. Could you please give us the comparison and also the explanation? This time in Shijiazhuang city, the epidemic is still spreading. However, we have effective measures in place in a very immediate manner so that we are avoiding the further circulation of a huge number of vehicles and people. But still, every day, we are discovering new confirmed cases. But if you look at it closely, you would find that the newly added confirmed cases, they are the close contacts of the previously confirmed cases. So it's still under control, the situation in Shijiazhuang city. After the first round of the nucleic acid test, these newly added confirmed cases are not discovered because they are still in an incubation stage and still in the window period. And then they are discovered during the second round of nucleic acid test. Locally, we are doing the screening of the nucleic acid test, so we expect to see some new confirmed cases for the next few days to come. From the first case until now, it's been 11 days. According to our past experience, usually it would take 2 to 3 weeks from the discovery of the first case to the containment of this pandemic locally. So if we can apply all the measures according to the schedule and also to the regulation, then we don't have to have too much worry about the situation. In Shijiazhuang city, some people are leaving the city to other cities, and for that population, we are also running the screening and also epidemiological researches. All in all, we are strengthening our efforts in the screening and also the investigation so that this epidemic will not be further extended from Shijiazhuang city to other places in China. Next question, please. Thank you. I'm from Pengpai News. Recently, we have noticed that some of the cases are confirmed after the 14 days quarantine, especially in Dalian city. Some of the infected cases, they are discovered after 4 rounds of nucleic acid tests, and that incubation period is quite long. Does it mean that this COVID-19 virus has developed new characteristics, for example, with longer window time of incubation? I'd like to give the floor to Mr. Wang Guiqiang. Thank you very much for your question. Indeed, we have noticed that there are some cases of long waiting period with long incubation period, but they are just some particular cases. Most of the cases would develop the symptoms of COVID within 14 days. Whether we have a longer incubation period with COVID, we still have to wait and see before drawing the conclusion. For the possible risk of being infectious even after 14 days of quarantine, the local governments and authorities have adopted new measures in response. For example, a 14+7 waiting period of quarantine. That means after 14 days of concentrated quarantine, they still have to stay at home for another 7 days of home-based quarantine. This is a measure to reduce largely the risk of possible contamination. So when people are staying at home for another 7 days of quarantine, they also have to follow certain rules. They should not leave their house deliberately, so that during the 7-day period, they could actually realize a very effective 7-day home-based quarantine and will not go out and have a possibility of further contamination. Now we should not relax our efforts in the response to COVID-19. We still ask people to wear the masks, reduce the possibility of excessive gathering of the people, and also wash their hands on a regular basis. By doing that, we can reduce as much as possible the risk of contamination. Next question, please. I'm from CNS. Recently, we noticed that in Shandong, Shanghai, and Guangdong, there are cases with mutation. Those are imported cases, and it is said that the mutated virus is more infectious. What are the risks brought by this mutated virus? I'd like to give the floor to Mr. Feng. Yes, in South Africa and also in the UK, we have discovered the mutation of the virus, and also in Brazil. The mutation is a topic of high interest of the global community, and we have also reached the consensus that we have to work together to carry out joint researches on the muted virus. With the mutation, the virus would be even more contagious. For example, there is an increase of 10 to 70% of a second round of contamination with the muted virus. And in Europe, especially in the UK and also in South Africa, the muted cases, the muted virus strains have become more prominent. A lot of indicators have been strengthened. The contamination capacity of the virus has been strengthened, but until now, we have not yet noticed that the degree of contamination is strengthened. For people contaminated with the muted strain, the hospitalization ratio and also the death toll ratio of the cases with the muted strains have no big difference from the people contaminated with a normal COVID-19 strain. But since today we have noticed that with the mutation of the strain, it's more infectious and it's spreading faster. This means that we have to strengthen our measures of response to the COVID-19 accordingly. So for example, if we can say that in the past we give 10 as the degree of our prevention and control of the disease, and now it should rise up to 12 or 15. But for the content or for the mix of the measures, they are the same as the past. For example, 14 days of quarantine after the arrival of the people traveling from foreign countries, and also for the measures of prevention and control inside the country, it's the same as usual. We ask people to wash their hands, to wear the mask, etc. But in some places of higher risk, we may have some limits of the circulation of the flow of the people and flow of vehicles. So if we can respect all the rules and regulations, we have the confidence to contain the tendency of the spreading of the virus until now. Next question, please. Thank you. I'm from the Reuters. So the pandemic picks up during the winter season. What is the priority of our work? Now, this pandemic has become the new normal of our society. What measures are in place to make sure that next year's Winter Olympics would take place according to schedule? Yes, in winter season, there's a higher risk of imported cases, and we are facing a higher pressure. And also in winter seasons, there are outbreaks of many respiratory diseases. So winter season is the major battlefield for us. For the prevention and control of COVID-19 and other respiratory diseases, we have to follow several principles set before. For example, to prevent the importation of new cases and also to stop the rebound of the domestic cases. As of avoiding more importation of cases, we have to respect all the routine measures at the borders. For example, prevention and control about the goods and also the personnel. We are in collaboration with the National Administration of the Customs and also with the Ministry of Foreign Affairs to do a better job in settling those people coming back from the other countries. They have to show the nucleic acid test results and also the antibody and antigen reports. For the quarantine of the goods at the customs, we also have a full process. On the surface of the imported goods, especially on the packages of the cold chain products and in the transportation carriers, we have all the measures in place to check, and disinfection is also a very necessary measure. At the same time, we also guide those cold chain related enterprises to strengthen their control measures. And for personnel working in the cold chain and other high risk sectors, we are also testing them on a regular basis. We also asked those personnel working in the high risk area to carry out the regular protective measures. For the restriction of the rebound of domestic cases at local levels, for the people working in hospitals and also in cold chain and other high-risk areas, like in the markets of agro products, we are running regular tests so that we can have an early discovery of the COVID cases. And secondly, for the key stages, for example, the exchange markets of the agro products, the hospitals, and also the stockage areas and transaction areas of the cold chain products, we are applying the measures accordingly. And we have also strengthened the investigation and the check efforts. If there's a problem discovered, we would immediately ask them to improve. Thirdly, for the key periods, we are also strengthening our measures. We now are asking people to reduce unnecessary travelings. We have 3 strengthenings and 3 reductions, and we ask the 4 parties to show their responsibilities. During the festival seasons, we also have extra requirements, for example, to avoid unnecessary gatherings. At the same time, we are also fighting against the combination of COVID with other pre-existing conditions. In a word, in fighting against the COVID, we have to follow the repeated measures like to wear the mask and also wash your hands to avoid unnecessary gatherings. At the same time, we also encourage people to get vaccinated. In hospitals, we also encourage the hospitals to accelerate their rapid test capacities for the single diseases and also the detection of the coexistence of several diseases. And next is the settlement of emergency cases. Once there's an outbreak of the cases, then we have to have an immediate dispatching of the people. For those places that have no outbreak of the cases, it's always recommended to never let down your guard and stay vigilant and also have enough reserve of goods and necessities. So if there is a possible outbreak, then in the shortest delay, you can respond to the case and also keep everything under control. And our journalist has also mentioned the 2022 Winter Olympics of our country. Currently, we have noticed some sporadic outbreaks of the COVID cases, but in general, we can say that in China, the response to COVID-19 is quite good. In Q4 of last year, we have already organized some games, and also the delegations visits from foreign countries to China to study our winter games. We're also preparing ourselves for the 2022 Winter Olympic Games, and we are accumulating more experience for next year's Winter Games. The most effective measures is to regularize all the measures against the COVID in the cold season. Next question, please. I'm from People's Net. On the 3rd of January, in the presser of Dalian, there is the super-contamination 1 to 33. What does it mean? Does it mean that this round of outbreak is more ferocious? For the people-to-people contamination, especially for the respiratory infectious disease, the super-contamination is a common phenomena. Talking about the super-contamination, from a professional point of view or from an epidemiological point of view, it means that from one patient or one infected case, the number of the second generation of cases significantly exceeds the normal level. So we call the first patient the super-contamination origin. Actually, we have a lot of studies in place. And for COVID-19, we have a lot of similar super-contamination. For example, in the past, we have noticed that in different places, the outbreaks of the pandemic would, from time to time, find a case of the super-contamination. So internationally, we also have a standard to define the super-contamination. We have the kappa value. So the kappa value for COVID-19 is 0.1. This means 10% of the infected cases, they are generating a super-contamination phenomena. So for the rest of it, 90%, one infected case would not cause too many other contaminated cases. But currently, we cannot tell in advance which case would lead to a super-contamination. Once we have discovered a super-contamination, it's already there, it's happened. Of course, we could have a retrospect to see in what kind of circumstances and in what kind of situation would be more probable that we have a super-contamination. As is mentioned by DG1, in rural areas, we have to reduce the organization of funerals and weddings during this period of time. If we can avoid unnecessary gathering of the people, then surely we can lower the risk of the super-contamination. In Dalian, we have the super-contamination of 1 to 33, but it doesn't mean that there is a significant mutation of the strain of virus. And in winter, we have a higher ratio of outbreak, and it's mainly due to the low temperature in winter. The low temperature would lead to a higher ratio of outbreak and spreading. One important way of the contamination of the virus and the spreading of the virus is the object to people. For example, the contaminated surface of a good, like the surface of the package of the coaching product, after being contaminated in a foreign country, then imported in our country, when our customers have touched the package of the contaminated goods, then they will get contaminated. And usually in low temperature environment, this virus could survive for a longer period of time, and this means higher efficiency of spreading and survival of the virus in winter. Now, in other countries, there is also a very high ratio of contamination, so this means that there will be a higher risk of imported case in the country. And that also explains why we have a higher ratio of outbreaks and higher ratio of contamination in China. And recently, some outbreaks, they first come from the rural areas in the countryside. So it means that in our management chain, there are still some weak points. So we have to strengthen those weak points. So technically, we need to come up with new measures. We have to innovate our management mechanisms so that in the countryside, we could be quicker in the discovery of new cases. And once there's a discovery, we can be more prompt in taking actions and in dealing with the patients. Next question, please. Thank you. I also have a question about the vaccines. Recently, we have started the vaccination of the key population, aiming at people of the age group of 18 to 50. What about the people of more than 60 years old? Madam Wang Bing, please. Thank you for your question. In general, we have put the COVID-19 spreading under control in our country, and the key objective is to prevent the importation of the cases and also the rebound of the domestic case. And currently, the measures are also aimed at the two avoids. According to our analysis of the previous cases, talking about the prevention of imported cases, we have to strengthen our efforts in the checks at the customs and also at the cold chain and hospitals. People working in those environments and workplaces, they are the key populations and they play a key role in the prevention and control of the imported cases. Those are the people that we call the key population, and also they are the first to be vaccinated. And domestically, when we are promoting the vaccination, in every place, we give the priority to the customs, and also we have prepared a sequence for the vaccination. So we would prioritize the people of high risk in the age group of 18 to 59. So this decision comes from the basic rule of avoiding imported cases and the rebound of domestic cases. Until now, we have also accumulated a lot of statistics, and also we are accelerating the production of the vaccines, as is mentioned by the Chairman Ying. So gradually, we would extend the coverage of the vaccination, and we will continue with this vaccination work in an orderly manner. In that case, more people would be protected, and our work would be more efficient. Next question, please.
Thank you very much. Tamara Anthony from German television. My question is, do you have, or what are the newest information or research on the host or intermediate host animal of the virus?
非常感谢给我提问的机会，来自于德国一台的记者。
So this is the translation of the previous question.
工作的开展方面，以及在中间宿主的研究方面，是否有任何研究的新的进展？谢谢。
好，我们请冯子健先生来回答
I'd
这个
like
问
to
题。
give this question to Mr. Feng Zijian.
近期呢，我没有看到这个
Recently, I have
所以
not
中间宿主他们研究的新的研究报告，现在没有
updates or reports about the intermediary hosts, but we are keeping up our efforts for the tracing. Tomorrow, experts team from the WHO will arrive at Wuhan for the tracing of the origin, and we are also in close collaboration with the WHO experts for the tracing of the origin of this virus. Next question, please. Thank you. I'm from CGTN. In the Lancet, we have published one of the achievements of China. They have realized evaluation of the status of health of the discharged cases from Jingyintan Hospital from Wuhan, and more than 60% of the discharged cases have still some of the symptoms 6 months after the discharge. Could you please give us more details? Thank you for your question. We have paid a lot of attention to the recovery of the cases. By February last year, that means with the beginning of the outbreak, we have already published relevant directing documents about the discharged patients' management. And gradually, we have accumulated more experience as to the guidelines of assistance to the recovered cases. We are doing better, and at local level, they have also attached great importance to that. For example, they have designated some hospitals to do the follow-up visits and checks on the recovered cases. They have also prepared the community level and home-based level treatment. For example, for the recovery of the respiratory function and for their heart function, and also for the psychological function, and also for the body functions, we have multiple treatments in place, and we have combined the Western medicine and the traditional Chinese medicine. In total, we are making sure that we have the whole process management of the health for the recovered cases. But still, we know that COVID-19 is a new thing to us. On the one hand, we can carry out the whole process management of the patients, and we are also carrying out the following up visits to the patients discharged from the hospitals so that we can know better about the big picture of this virus of COVID. And all those following up measures would also help us to enhance our understanding of this disease. Mr. Wang Guiqiang is also an experienced expert, and I'd like to give the floor to Mr. Wang for more details. Yes, as is mentioned by Madam Guo, we have multiple policies in place to help those recovered patients. We have the solutions for them even after we discharge those patients. We have the following up visits. So those are a special group of people. Many doctors today, they are also working on the treatment after the discharge. For most of the discharged patients, they have already recovered in a very quick manner. But for those people saved from the severe or critical conditions, it takes more time and patience for they to be back to the normal status. So for that article in The Lancet, you know that they are talking about the cases from Jingyintan Hospital, which is a designated hospital for the cases in severe and critical conditions, and most of them old people, the elderly generation. More than 70% of the people need an oxygen treatment. So this means that they are in severe conditions, and we can understand that after being discharged from the hospital, surely they will also need more time to be recovered to a normal status. But here, as we can see that most of the patients can be restored and recovered, just some cases need more time than other people. Next question, please. Thank you. I'm from Hongxin News. Currently in Jiangsu and Zhejiang provinces, they have sent their teams of tests, of nucleic acid tests, to Shijiazhuang city. How many teams of these tests have you dispatched? Will you add up more personnel to help the medical treatment and also the diagnosis in Shijiazhuang? To Madam Guo Yanhong, please. Thank you for your question. After discovering the outbreak in key areas, we have immediately organized the nucleic acid test for the key populations and also for the key areas. With the test results, we can define the area contaminated and also the population contaminated. With the nucleic acid test results, we can also have the early discovery and early diagnosis as well as early treatment. It can help us to increase the cured ratio. We have discovered the indicative case on the 2nd of January, and immediately for the key areas and key populations, we have started our efforts. And for Shijiazhuang City and Xingtai City, we have carried out the whole population nucleic acid test. So immediately we have started this nucleic acid test, but still we are facing a great challenge in supporting the nucleic acid test in terms of the materials and also the personnel. Very quickly, the province has mobilized the resources in reserve, and at national level, we have also dispatched our teams from different provinces. As is mentioned by you, from Zhejiang and Jiangsu, we have also sent one testing from Beijing and also representatives from the P3 laboratory in Beijing from the CDC. So all the efforts are combined together to ensure a whole population test. On the 9th of January in Shijiazhuang and Xingtai City, we have completed the first round of nucleic acid test on the whole population. And currently, we are carrying out the second round of the nucleic acid test on the whole population. We are actually tapping the potential in the province and at the same time adding up new forces from the other provinces. Every day, we have the testing capacity of 1.1 million samples. And for the NHC, from last year until now, is accompanying the localities to strengthen the capacity building of the laboratories, and also we are also improving the efficiency and the quality of the testing work from different provinces and regions. According to the statistics, until January, we have 8,437 institutions across the country to do the nucleic acid test. That is 4 times the level of last year by March. So currently across the country, we can realize the overnight tests of nucleic acid of 12.5 million samples. That is 10 times the level the same period of last year. So you can see how much we have progressed. And this time during the new round of outbreak, we will continue to stay by the side of the institutions to improve their precaution plans for the tests so that we can support our diagnosis and discovery of the COVID cases. Next question, please. Good afternoon. I'm from South China Morning Post. We know that tomorrow we will receive an expert team from WHO. Could you please tell us the trajectory of them and also the timetable? And also a question to the chairman, Ying Dong. For the application, what indicators should we use? Because there are several available indicators. First of all, I would give the floor to Mr. Ying Dong to your second question. For the application of entrance into the market, we're about to communicate with authorities in charge. Actually, all the indicators during the stage 3 clinical trials are very meaningful for the entrance into the market under condition. But first of all, we will discuss with the authorities to do the analysis on the data and also do an examination of the data. After reaching and meeting the standard, we're about to hand over the statistics to the authorities. And when it is possible, it will be entering into the market. And talking about the first question, for receiving the delegation of experts from WHO, we have already released relevant information on the government website. Tomorrow, that is the 14th of January, the WHO expert team will arrive in Wuhan. According to the regulation, the experts will first go through a period of quarantine, and Chinese experts can start in advance a video chat with all those WHO experts during the quarantine time. We know that WHO will also carry out similar visits to other countries, and we, Chinese side, will collaborate further with WHO for the future tracing work of this virus. Due to the limit of the time, we're about to take another question. I'm from the CCTV Finance channel. We know that COVID-19 vaccine is a new product. How could we ensure the safety and efficiency of the vaccination? To Madam Wang Bing, please. In our country, we have started the vaccination of key population from the 15th of December last year. Currently, we are vaccinating more people. Until now, we have already vaccinated with 10 million doses. The vaccination is going on in an orderly manner, and locally we have also accumulated experience and also developed very good practices. For example, some places have set up the temporary vaccination spots, like they have put the installations in a very vast buildings, like in the stadiums, in the sports centers. This will facilitate the vaccination. Some other places have also opened the reservation booking channels online. People would first enter their personal information online, and then when they arrive at the spot, the medics would do the checking of the information, so people don't have to do the registration on the spot. This will accelerate the on-site vaccination. And again, we will give the priority to the people working in key areas like at the customs. And according to the national requirements, the local governments are doing the arrangement and layouts of the measures of vaccination. We have prepared the plans, the technologies, the vaccines, the materials, and also the emergency response mechanisms, those 5 preparations. And also we have 5 timely measures. First, timely publication of the document, timely settlement of the emergency, timely guidance to the people, and timely management. With time passing by, I believe that we would finally expand the vaccination from the key population to a larger scale. The last question, please. Thank you. I'm from CCTV New Media. In light of the recent development of COVID-19, some of the cases are asymptomatic, and among which we can find the drivers of the Uber-like service. So what are the measures? For the COVID-19 cases, some of them are asymptomatic cases. And in the international arena, we notice that the asymptomatic cases also have the possibility to further spread the virus to other people. However, compared to confirmed cases, the contamination capacity of the asymptomatic cases is only 1/4 or 1/3. So today, for the confirmed cases and also for the asymptomatic cases, we would apply the same measures. They have to follow the quarantine, they have to go under treatment, and also they have to respect the medical observation. So you have also mentioned that some of the asymptomatic cases, they are the drivers of the ride-sharing industry. So today we ask every driver of the car-sharing industry to wear a mask and also to pay attention to the condition of their hands. Thank you very much for your response. So today our experts have taken 18 questions from the journalists about the measures on COVID-19 prevention and control and the medical treatment. If you have further questions, please save it for the next time and also stay in touch with us. Thank you. That's the end of today's conference.